we connect you to a women's healthcare provider for telemedicine visits for women. So please, if you need women's healthcare, and even if you're not sure if telemedicine is for you, if you go to our website, womenshealthonthego.com, you can schedule a free 5-minute phone call with me to see if, telemedicine is for you. So we're just going to typically I get on and I talk for a little bit and just trying to figure out all this stuff, which obviously it's a little crazy tonight. And I do go over history and I go into what we're going to talk about tonight. And so we're a little backwards tonight, so I do apologize, but this is what live streaming is all about. It's just going with the flow here. So April is STD Awareness Month. So I thought that it would be great to start off with just talking about STDs. When I was prepping for this show, there is so much information about STDs. And I don't know if I'm going to get to all of it tonight. And I know sometimes I have a lot up here and I'm trying to convey everything. So I do have I want to go through some stuff with you. There's just so much information about STDs and all the different STDs that are out there. So let's try to get through as much as we can. But I am going to mention one thing from history that actually is relevant to STD Awareness Month. This week, now this day in history wasn't too exciting, but when I can't find something too exciting on the actual day, I try to look at the week. And on April 8th, in 1999, an 18-year-old boy named Ryan White died. And he died from complications from HIV/AIDS. And he was a hemophiliac, which is basically a condition that he had all of his life and has to do with blood clotting disorder, okay? And he actually got HIV from a blood transfusion. Now, unfortunately, because back in 1999, the knowledge about, STDs and HIV wasn't we weren't as knowledgeable back then as we are today. And, it was really sad because he actually, when he was 10 years old, he was actually banned from school. Nobody wanted to be around him. Nobody wanted to talk to him. So him and his mom actually had to move to a different area in the state. I think it was Indiana, that he was in Indiana. And, it was, eventually he was, accepted in the school, which was great. But because of him, the knowledge about HIV and about, you're not going to get it from sitting next to someone or sharing a pen or a pencil with them, he really kind of opened the eyes of a lot of people. There are actually, in New York, there are the Ryan White centers. There's medical centers that are named after him. So I think it was kind of, when I read that, I was like, oh my gosh, I didn't realize that this is when he passed away. And it's kind of appropriate because here it is, STD Awareness Month. So I just wanted to, point out that, Ryan White, unfortunately, he passed away from HIV, but what we've learned from that is very, very significant in today when we are dealing with HIV. So I just thought that was an interesting piece of history. First, I want to talk about when it comes to STDs. I am going to start going through all of them, and again, I am not sure if I'll get through all of them tonight, but one thing that I think is really important is screening and talking to your provider about screening. Now, most people, when they go to their provider, sometimes people don't feel comfortable talking to their provider about it, and sometimes a provider might not feel comfortable talking about it. So I think it's really important that you find a provider that is willing to have a very open conversation about STDs and your sexual habits, because there are STDs that you can get in your throat, there's STDs that you can get in your backside, and of course in the vaginal area. So it's really important to be able to have an open conversation with your provider about what are your sexual habits, to know what you need to be screened for and where you need to be screened for them. This is something that I have learned over the years. And when you're having that STD, yes, I want to have STD screening. Okay, well, I need to get a little personal with you right now. And I only need to get personal with you because I need to know how to screen you. I need to know what to screen you for, where to screen you for, especially when it comes to like chlamydia and gonorrhea, which will go a little bit more in depth. But, you can get oral, you can get it in your throat, and you can get it, like I said, in your backside, and there are swabs that you can actually do in order to see if you have them there, okay? And then you also have to be very comfortable with talking about, when did you have, are you concerned about the partner that you have now? Are you concerned about the partner that you've been with for a whole, really long time, or maybe you notice maybe something's going on now? Or I have multiple sexual partners. I use condoms. I don't use condoms. Because also there's what we call incubation periods when it comes to STDs. And each STD has an incubation period. So what does incubation mean? It means that today we'll talk about herpes, okay? So today I had sexual relations with someone and they have herpes. And when can I be tested to see if I've actually, I've obviously been exposed, but I have actually contracted the herpes virus? Well, if I'm going to have an outbreak, typically that can happen within a week up to 3 months, right? It can happen at any time. But in order to get tested for blood, our body actually develops antibodies for the herpes virus, and it can take up to 3 months for it to actually come out positive in your blood. So if I've been exposed to today, and I go to my medical provider tomorrow and say, oh my God, I was with somebody yesterday, and they told me after we had unprotected sex that he's got herpes. I need to get tested, and I need to get tested now. Well, what I can do is I can test you to see if you've had it for a long time, for more than 3 months, but I can't test you for that exposure that you had just yesterday. What I would recommend to that person is coming back after 3 months to get screened. Sometimes I always tell people, sometimes people want to get like a baseline. They're concerned about someone that they just had sex with, but they want to come in for screening, and I will tell them about incubation periods. But I'll also say, but if you want to get like a baseline to know exactly where you are, because, maybe you've had other sexual partners in the past, then, we can definitely do that. But then I always recommend coming back in 3 months and 6 months, especially when it comes to HIV, depending on when your exposure, like HIV is another kind of testing. There are some tests that can be done with early detection within a certain time frame. So there's so many dynamics when it comes to testing and screening. And that's why it is really important that you're able to talk to your provider. You're able to be comfortable with that person and talk about, I say to my patients, listen, I got to get really personal with you right now. And I only need to know it because I need to know how to screen for you so that we can make sure that you're positive, negative. If you're positive, we need to treat you. So it's very, very important that you have that open conversation, or able to have that open conversation. Or even if, being knowledgeable about the different types of testing that you can have, so that when you can go to your provider and say, okay, listen, I know that I've been, I've doing this sexual habits. I know that I can get this here, and I want this kind of testing. Because there are a lot of medical providers, which, it's just, some people have different specialty areas than other people. And some providers still don't feel comfortable talking about sex, or they don't really have the knowledge of what kind of testing can be done. Herpes is one of them. That could be I mean, I've had a show on herpes, talking about herpes, but when it comes to herpes testing and understanding your results, that can be a little bit more complicated. And I think it's really important to know what kind of testing there are. When we test antibodies for people, there are two kinds of things that we can test for. There's IgM, which to me, M means immediate, right? So that will tell me if you have recently been exposed to something, if you're actually having the infection or whatever it is at that moment. And then there's IgG, G for gone, meaning that you've been exposed to it a long time ago, but now your body has developed antibodies against it, and that's why you're testing positive. The thing with herpes is that doing an IgM is a big no-no. It's not necessary. It's not going to tell you anything. It can actually come out positive if you've actually have had it a long time ago. So some providers still do IgMs, and it's not really recommended to do that. If you're going to do, you got to do the IgG. I hope that makes sense, because that can be a little confusing at times. But you want to make sure that you know what kind of testing to get, even if your provider might not, be very knowledgeable. At least if you go in, and say, okay, listen, Dr. So-and-so or nurse practitioner or whoever it is that you're seeing, listen, I know that this is my exposures, these are the kind of tests I can get. I think that wouldn't be a bad idea. Hopefully that makes sense. And it's no offense to any providers. If you came to me and asked me to do cardiology tests, I might not know that, because cardiology is not my area of expertise. Boobs and vaginas are my area of expertise. That's what I always tell people. I always say, listen, if it has to do with your boobs and your vagina, talk to me about it. Anything else, you got to go to your other specialist. So hopefully that makes sense. So that's with screening. I really think that it's important that you're able to talk to your provider, and I think it's really important to make sure that you get good testing. Okay, now we're already 8:22, so I'm going to go over a couple of these, and I may actually go back to this, also next week, because there are actually a lot of STDs out there, and some of them are still very prevalent today. There's the CDC. They're obviously celebrating, or whatever the word is, STD Awareness Month, and they have this whole awareness of syphilis, because syphilis is back on the rise, and so really want to make sure to talk about syphilis. And I do have to maybe I'll try to keep syphilis for next week, because I want to get my Wirecast up, because I was very, very excited to tell you that I was going to show you actually pictures, because I had a request of visuals, and that saying, I would love to see some visuals of things when you're talking about these things, because for me, I learn a little bit better when I see things. And I had all these awesome pictures to show you that were on my computer, and now I can't kind of show you them because they're on my computer. So maybe we'll show you next week those things. Okay, let's talk about two infections that are very common still. We've got chlamydia and we've got gonorrhea. Now, chlamydia tends to be a little bit more common. It is the most commonly reported STD in the U.S. It is very common between the ages of 15 to 24 years of age. And the same actually goes for gonorrhea. This is why it's very important for even our young folks to be able to speak open and honest and be able to go someplace to get STD testing. That is very, very important as well, which there are lots of free STD clinics all over the place. And if you are, I say this in a very good way because I know some people might not agree with this, but if you are underage and you need to speak to someone about, getting STD screening, or talk about sexual health, you can actually go to clinics. There's lots of clinics, and you don't need to have a parent with you. Now, I know that maybe some parents might not be very happy with me saying that, and I understand these are your children. I totally understand that, but I think it's very important for their health for them to be able to not only talk about it, but also to get screened. When you talk about chlamydia, one of the huge reasons why we have problems with infertility later in life, now we've got a couple things that cause infertility, but one of the things is chlamydia that's not treated. It can cause scarring in the fallopian tubes, and it can cause problems with infertility. And so we really want to make sure that our young are able to be open and have these conversations and be responsible. I mean, I think that if a young person is being responsible and seeking help and to have that conversation to get screened, I think that is so awesome that they're actually doing that. But we really need to be able to be open and have that conversation with our younger group of people, because if they don't have access and they don't get treated, if they do have these things later on in life, they may have problems, and we want to make sure that they don't have problems. So I'm sorry I got off on a sideline there, but that I think is very important. So, okay, how do we get chlamydia? We get chlamydia from having unprotected sex with someone. It could be from, remember, I told you that we can get infections orally and anally, but these definitely chlamydia and gonorrhea are both two that can happen. Because it's exchange of body fluids. You can get it from having oral sex. You can get it from having anal sex or vaginal sex. Now, if we're talking about, if we're going to get it orally, it's going to live in the back of our throat. It's not necessarily going to be like around the front of, so it's not like you're going to kiss somebody and get it. It's in the back of your throat. So typically, if you're going to get it, men are not necessarily going to get oral chlamydia from performing oral sex on a female. But anybody who performs oral sex on a male can get it. Because if you just think about the penis, you think of where like the opening is, where there may be body fluids coming from and hitting the back of the throat. So hopefully that makes sense. So if someone is performing oral sex on a female, the chances of, and also, I'm sorry, I didn't mention this, the infection resides in the cervix, resides in the throat. It's really far away. That's not likely to happen. It's only from when performing oral sex on a male partner. But you can get it orally, you can get it anally, or you get it vaginally, and it's from exchange of body fluids. Majority of people, I think it's about 70% in women, are not going to have any symptoms of this. So this is another reason, very, very important, if you're sexually active, if you're having unprotected sex, that you go and get tested for this. And it's a very simple, we're talking about oral and anal, those are very easy swabs, but even for vaginal, you just have to pee in a cup. You don't even need to get a GYN exam to get tested for chlamydia or gonorrhea. It's simply peeing in a cup. That's it. It's a very, very easy test. And even for males. Back in the day, when I started working in this area, I worked in a clinic so women's health care providers can also do screening on males because it has to deal with reproduction. So I worked in a clinic where we also would do male STD testings. And back then, there was actually a swab that had to go down the shaft of the penis in order to get the test for chlamydia. I'm sure that lots of men would be very happy to know that now you just have to pee in a cup. It's very, very simple, and it's not as, because it is painful, it's not a very comfortable test for males. So if you are a male and I can't even say it, you happen to be watching this, then just know that it's a very, very simple test. You just got to pee in a cup, okay? Again, infertility can cause infertility problems down the road. It can cause what we call a PID, which is pelvic inflammatory disease, which is an infection inside your uterus and your fallopian tubes and your ovaries. And that can be very severe, that you can be hospitalized for that. So that could be life-threatening, depending on how far advanced it goes. If you are pregnant and you have chlamydia, typically in prenatal care, you will get tested in the beginning of pregnancy and at the end of pregnancy. And reason being is it can cause, if you have it, it can cause preterm labor. It could also, when you're delivering, it can cause the baby to get chlamydia infection in their eyes, and they can also end up with pneumonia. One little side note, so to me this is a very interesting thing. So I used to live in London, and when I was in London, I was the head of a chlamydia screening program. Because over in the UK, they're very into prevention medicine. So they were noticing that women were having more problems with infertility. Okay, so what causes infertility? So one of the things is chlamydia infections. So they say, okay, so what age is the most common? 15 to 24. So they got a screening program for just to get as many people between that age to get screened to help prevent problems down the road. So in my research when I was over there, one very interesting thing that I learned is, did you know that chlamydia is a huge problem in koala bears? Now, I was pretty amazed with this. I couldn't believe it, but yes, they actually get it in their eyes, and it's a very, very huge problem, and it actually causes blindness in koala bears. So I found that a very interesting fact. I just thought that was a very, very interesting fact, that you can actually get that koala bears, it's like a huge problem. It's a very, very huge problem. So very interesting. All right, so signs and symptoms of chlamydia. Like I said, sorry, 70% of the time you're not going to have any symptoms. But if you do have symptoms, you may have a yellowish creamy discharge, you may have irritation, you may have pain during sex, you may have spotting after sex, you may have irregular spotting in between your periods, you may have pain upon urination, and that's, I think, about it. Or you can have pelvic pain, especially if it's starting to get into what we call, remember that PID, that pelvic inflammatory disease. So there's lots of things. And in males, just in case there's any males watching, you can actually get enlarged testicles. It's very rare that that happens in males, but it can happen. And like I said, it's a simple urine test or an oral swab or anal swab. They're very, very easy to do. It's easily treated with an antibiotic, but it is very, very, very important to realize that it's not a case of once you get it, you get treated, and then you're immune to it the rest of your life. That is not going to, I'm sorry, I'm just looking at comments. Nicole, that needs to be your next Fun Fact Friday. You're actually right about the koala bears. You know what, I totally forgot about the koala bears until I was like, oh my gosh, yes, that's right, it causes eye infections in babies. It causes eye infections in koala bears. Absolutely, Nicole, and thank you so much for being here. Just because you get it and you get treated, it does not mean that you will not get this infection back again, okay? If I get, first off, you have to have your partner treated at the same time, okay? You should take the antibiotic at the same time. You should not have sex with each other for at least a week, okay? I cannot begin to tell you how many times people come into me, they're like, I couldn't wait. And I'm like, seriously? You couldn't wait 7 days? Or even if you're going to do it, at least use a condom. I mean, yes, the ideal thing is to make sure that you don't have sex. But 7 days, really? You couldn't wait? I cannot begin to tell you how many people actually do that. So absolutely, you and your partner, I always recommend taking the medication at the same time. That way you have the week. If you're still not with that partner and you want to just take it, that's fine. If you are not with your partner anymore and you're not talking to your partner anymore, your provider should help you with partner notification. And it could be anonymous as well. If a patient came to me and said, listen, I was with that person, I got their number, I don't want anything, I don't want to talk to them, I don't want anything, I'll be like, fine, I will call them, and I can also say, hi, all I can tell you is that you have been exposed to chlamydia. I highly suggest that you go to your medical provider and get treated. Well, who? I can't tell you who. It's completely, you don't need to tell anybody anything. But just, it is a good idea to tell that person, because sometimes people get, in my experience, sometimes patients get very angry when they find out that they have contracted an STD from someone. And they don't want to do anything with that person, and they don't want to notify them. I highly encourage it, because they're going to be with someone else, and they're going to expose someone else. So for the, what would we call it? We're going to call it for woman power, for girl power, for helping all your fellow women out there, okay? Just make sure that you just somehow tell your partner so that they can get treated, okay? Hopefully that makes sense. So, hi Jane, how are you? Jane, I'm very happy to see you here. Jane is, for everybody, we're going to be having Jane on our show next month. She is a health coach. I did put a link to her page on the web page, so on my Facebook page. So make sure that you check her out. She's got a book and everything. I'm really, really excited to have her on. And hi Fiona, how are you? Hopefully you're still here. I hope you're doing well. Okay, so I'm going to go over gonorrhea next, which is a little bit kind of like chlamydia. It's a little bit different, but for the most part, gonorrhea is the same thing. Gonorrhea is not as common as chlamydia, and typically, if you do get gonorrhea, you might not have symptoms, but a lot of the time I find that when people do have symptoms, it kind of ends up being, not necessarily that it ends up being gonorrhea, but because sometimes people will come with symptoms of chlamydia, but if someone didn't come to me, like if someone came to me and got screened and they had gonorrhea and didn't have any symptoms, I'd be like, oh wow, you didn't even have any symptoms. Hopefully that makes sense. Again, this is something that you can get orally, vaginally, or the backside, rectally. It's, again, very common between the ages of 15 to 24. It's not good if you have it during pregnancy. Again, it can cause complications just like it does with the chlamydia. And for the most part, the symptoms are going to be the same. So for the most part, gonorrhea is pretty much kind of the same. You can have discharge, you can have burning upon urination, you can have pain with sexual relations. Excuse me, you can have discharge, you can have spotting after sex, you can have spotting in between your periods, you can have pelvic pain, you can have pain during sex, you can also just not have, but you can have pelvic pain at any time. So for the most part, your symptoms are going to be the same. It is, again, a simple urine test or oral or a rectal swab. Now, treatment with gonorrhea is actually becoming a little bit difficult these days because I'm sure that a lot of people know what antibiotic resistance is. So basically what that means is that basically what it means is gonorrhea is getting really smart, and it's saying, you can try to get rid of me with that antibiotic, but now I know that antibiotic. And you know what? that antibiotic is not going to work anymore. Give me another shot. Come on, give me something else. Let's see what else I can learn and make sure that I'm going to be resistant to it, because I'm sticking around. I like being around, and I am not going to be completely eradicated. Does that make sense? Hopefully that does. So basically, antibiotic resistance it's happening with so many antibiotics, with so many situations, and that's why, let's talk about antibiotics in general. You don't want to just go get or take antibiotics for anything, or I think I have a cold. Most of the time colds are colds and they're viral, and you don't want to really necessarily take an antibiotic. Sometimes we do because they're bacterial and they're not going away on its own, and I totally get that. But there's more and more antibiotic resistance that is occurring, and it's going to be harder to get rid of these infections later in life, when we're going down the road, because these bacteria are getting smarter and smarter each day, and they're learning the antibiotics, and they're just not going to be working. Also, when we use antibiotics, it also gets rid of good bacteria in our body that helps keep us healthy. So this is what's happening with gonorrhea. Okay, there is a resistance. Now, I know that there was cases of resistance in California. Now, this was a while ago, so I don't know. I tried to look up in New York, because I know that the last place that I was working at, what would happen is we were working with the Department of Health and doing some cultures to see if there was any antibiotic resistance. And I don't think there was any cases in New York. Again, it's been a while. I tried to see online if there are any cases of it. So, but because of this resistance that's going on, typically you would get an injection for gonorrhea, and that would be it. But now they're having you do a dual. You'll still have to get the injection, but you have to get an oral antibiotic, which is azithromycin or Zithromax. Most people know it as Zithromax, because they're finding that if there is resistance, the combination of these two antibiotics is the best route to go. So, I don't know what's going to end up happening with it. It is a problem, because once you go through, there's not many antibiotics that can take care of gonorrhea, and once we run out the antibiotics that can, I'm not quite sure they know what's going to be, what they're going to be able to use. So make sure you protect yourself. Make sure you use condoms. Very, 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 very important. So I know I only went over 2 different STDs. We've got a whole month to go over all of them. It's a lot of information, and I think that talking about STDs is very, very important. It's important because some of them do have long-time sequelae. Some of them you can't get rid of the rest of your life. We're going to talk about herpes. I actually have a wonderful woman. Her name is Melissa. She's going to be coming on in a couple weeks. She's a therapist, and she actually runs a herpes support group for women who have been diagnosed with herpes, because it's a very emotional thing to get diagnosed with herpes. It's huge, and this is one of my pet peeves when it comes to herpes. Not every provider tests for herpes. So, some of these things have long-term effects on us, and health-wise, mental-wise. So I think that it's really important that we really talk about STDs. We are open about it. We're open about having the conversation about sex. We're all having it. Well, most of us are. I mean, maybe some people aren't, but we're all having it. It's just like, to me, it's just like, we all go number 2. We all go to the bathroom, all right? So just let's have the conversation about it. It's not that big of a deal. We all do it. And I think that talking about STDs is very, very important. It's important to be able to talk to your partner about it, especially a new partner that we have, having that conversation about, okay, have you been tested? What have you been tested with? Being open and honest with each other is very, very important, and making sure that you get screened for everything, and using condoms. Condoms, 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 condoms. That's all I'm going to say. New partners, condoms, 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 condoms. That's all I'm going to say about that. So, all right. So I think that we're going to end. I so apologize for earlier. I was having a little bit of technical problems, but I'm hoping by next week we are back on track. Again, I'm using this new system. I thought I had it down pat. I guess I don't. Something got glitched in the system there, but we'll figure it out. I got a whole week to do it. Next week we're just going to continue talking about STDs. I actually really like talking about them, so maybe that sounds a little weird, but it's what I know. I love talking about them. I love educating people about it, and yeah, that's all I got to say. So, Lori, for Women's Health on the Go, provide telemedicine to women for all their gynecological needs. Might not be able to do a pap smear or telemedicine, but there are so many things that we can do via telemedicine. So if you want to, go to my website, womenshealthonthego.com, and there's a video there that talks about what we can do. If you're not sure if telemedicine is for you, then you can book a 5-minute free phone call with me so we can talk about it and we can see if telemedicine is for you. So thank you very much for showing up. Sorry for all the confusion tonight, but we will see you next week, hopefully on Wirecast. So much better than with old school, but old school is definitely good. Thank you very much. Have a wonderful, wonderful week, and thank you everybody for showing up. Thank you, Nicole. Thank you, Jane. Thank you, Fiona, and thank you, Dave, and anybody else that was out there that might not have commented. Thank you very much for showing up tonight. Talk to you soon.